Good day. I'm Simiso Sokela, here to present the Advanced Study 96-week data. This is an investigator-led study comparing dolutegravir, emtricitabine plus 2 prodrugs of tenofovir with the efavirenz-based standard of care for the treatment of HIV-1 infection. Dolutegravir and tenofovir alafenamide offer toxicity and cost benefits. In addition, dolutegravir also offers resistance benefit in an era of rising NNRTI resistance, currently estimated to be between 5 and 15% in South Africa. I will be presenting the 96-week primary efficacy analysis, but additional incomplete data is also presented here, as well as earlier data. The advanced study, conducted in Johannesburg, South Africa, included ART-naive participants with HIV RNA above 500 copies per ml and randomized participants into 3 arms. TB and pregnancy were exclusions. Participants were followed up at week 4, 12, and 12 weekly thereafter up to 96 weeks. The study is ongoing and participants are now followed up every 24 weeks up until week 192. Baseline characteristics were similar across all 3 arms, with a median BMI of 24, a mean CD4 count above 300, and the RNA levels similar across the arms. Participants were mostly Black, including South African citizens and those of neighboring countries. The main efficacy endpoint used the last HIV RNA level for each participant in the week 96 window. Participants with missing data were classified as failures, and those with HIV RNA levels above 50 copies per ml were offered adherence counseling and retested within the week 96 window where possible. Treatment arms were first compared for non-inferiority, then superiority. Participants in the 2 dolutegravir arms achieved viral suppression faster than those in the standard of care arm. But by week 24, the proportion of participants with HIV RNA levels less than 50 copies per ml was similar across all arms. This similarity was maintained up to week 96. Very few participants experienced virological failure in the study across all arms. Treatment-emergent NRTI and NNRTI mutations were observed in the standard of care and the dolutegravir TDF arms, but no such mutations were noted in the TEF arm. None of the patients experiencing virological failure had developed treatment-emergent integrase inhibitor resistance. The standard of care arm had slightly higher percentages of clinical adverse events compared to the 2 dolutegravir arms. This was driven mainly by short-term liver enzyme elevations. We had 5 deaths in the study, but none of them were related to the investigational products. The standard of care arm had a higher percentage of participants experiencing grade 3 and grade 4 laboratory abnormalities. As explained in the previous slide, this was mainly because of short-term liver enzyme elevations in asymptomatic participants. Few renal adverse events were reported across all arms, but these were noted more in the dolutegravir TDF arm. Bone density measurements done at baseline, week 48 and week 96 revealed that the TEF arm had the least number of participants developing hip or lumbar spine osteopenia, while the standard of care arm had the highest number. Men in the 2 dolutegravir arms were observed to gain more weight than those in the standard of care arm, with the worst weight gain observed in the TEF arm. At 96 weeks, the average weight gain for men on the TEF arm was more than 3 times that observed for men in the standard of care arm. Incomplete 144-week data seems to suggest that this upward trajectory continues. Women in the TEF arm gained significantly more weight than those in the other 2 arms. The average weight gain in the TEF arm was 8.2 kilograms at 96 weeks. 4.6 kilograms in the dolutegravir TDF arm, and 3.2 kilograms in the standard of care arm. This data confirms the 48-week data that was presented at IAS in 2019 and published in the NEJM. Similarly, the incomplete 144-week data suggests a persistent upward trajectory, particularly in the dolutegravir arms. Of concern are the body composition changes, which are more pronounced in women than men. Mass increases were largely fat over lean gain, and they were distributed between the trunk and limbs across all 3 arms in the study. Gain in fat mass was significantly higher in females compared to males. The results also show statistically significant treatment-emergent metabolic syndrome between the TEF and the standard of care arms for all participants. In conclusion, this trial demonstrated similar HIV viral suppression rates across all 3 arms. A slightly higher risk of treatment-emergent NRTI and NNRTI resistance was demonstrated in the efavirenz arm. Participants in the TEF arm had significantly higher mean rises in body weight, greater rises in trunk fat, and a higher risk of metabolic syndrome, and this was more for women than men. These results present a complexity for developing world programs as we transition to dolutegravir-based regimens and support the WHO treatment guidelines reserving TEF and DTG for patients with osteoporosis or impaired renal function.